How have you
Start
been?
with my end. I've been okay. I found this amusing. I'm like, gosh, this is going to be like my every 6 months counseling session with you.
I don't know about that, but yeah, it's been, shoot, when was that? Back April, probably.
I think so. So I think it has been about 6 months. Yeah. So it's about 6 months,
What's
just like that.
what's been going on?
I think Mesa County has some pretty impressive numbers that's just come up, apparently.
Yeah,
It's like
I
a big mess.
I'm really surprised it took this long. But it's really sad to see once they started going up how dramatically and quickly they increase. And I still feel like there's little concern among most people about it.
Hmm. Yeah, and then fortunately at this moment, we at least in Montrose, we don't have the same hospitalization rate. We've had our numbers go up some, but it at this moment it feels like the people who have already had a first wave of it, or first or second, like this third wave for us at the moment, doesn't feel like the people are as sick as they were before. Um, so it'll be interesting to see in Mesa what those hospitalizations look like with this big bump for you guys. You know, so that'll remain to be seen in terms of hospital beds, and whether it all comes down to reporting. Also, um, is the truthfulness in reporting with who's in your hospital.
Yeah.
So yeah, so that's another piece of this. We were all fast to point our finger at China and say, well, they weren't being truthful about things, and we haven't been truthful about it at all either. So it's hard to manage something when you don't have actually accurate data as well.
Mhm. How are you you had started doing some telemedicine. How did that is that something you continued with over the summer, or um are you thinking, are you
Yeah.
using telehealth?
I am using telehealth currently. It probably, at this moment, it might be one telehealth visit a day, maybe two, perhaps. I find that often it's, Telluride patients, or I've had elderly folks like that have just been discharged from the hospital, so potentially difficult in getting to my office. So I might do a telehealth visit with them, but clearly markedly fewer than I was doing back in April. I'm still managing the office in a way to try to minimize people in my waiting room at any one given moment. So much more scheduling of flu shots, immunizations, blood draws, urine tests, etc. So trying to know when those folks are arriving so that we can coordinate that in the schedule, so I don't have more than one or two people in my waiting room at any one time. So, that has continued. And obviously with numbers the way they are, our Montrose numbers are okay, but I think it's just going to spill down the Western Slope. And it's just a matter of it getting here, I think,
Mhm.
in that way. And, 2 weeks ago, we had a church outbreak that I think there was 15 people or so in one single church that bumped our numbers up. And then a construction crew that unfortunately was working with our school district. So that kind of, the school had to manage that with that construction company. But, all in all, our numbers have been not, you know, not certainly not what they are in Mesa right now. But, I think as the weather gets colder, more people indoors, all of that. And then here we are with the holidays coming, so I think in general, the Western Slope has been somewhat purposeful in not following guidelines.
Yeah,
So here we are.
here we are.
Right? A predictable event.
You
Here
want
we
to
are.
talk about purposeful in the Western slope? Never mind. I'm not going to get into politics.
So yeah, and you know, it's hard not to get into politics with this discussion because this pandemic became a political event right out of the gate. So it's hard to segregate those two things. And historically, in my practice, I have really tried hard to keep religion and politics out of my office in the sense that it's not a discussion I need to have per se in my office. I mean, religion may come into play only in terms of a discussion with advanced directives for patients, which I have lots and lots of conversations about advanced directives and end of life care. So religion can come into play in that context, especially if I have patients who are Jehovah's Witnesses, you know, then being respectful of their wishes in that context. But it is something that I've really tried to not have that come into play in my office. And, you know, unfortunately, in the last 6 months, it has come into play because now I have a very small group of patients, but you know, are you really coming that you're going to debate science with me as your physician? You know, I'm your physician for 20 years and you're going to have a discussion with me about whether or not masks are useful. So that has been a challenging aspect for me. And that is a line that I clearly draw in my practice, meaning you don't have a choice whether to use a mask or not in my office. And yeah, and if you make that choice to not, then you can not be my patient. It's pretty simple. So that it hasn't been a big part of the practice, but it consumes a fair amount of my energy, if you will, when I have to deal with those folks. So I can tell you my my patients. I don't have a big bucket load of patients these days, so those are decisions I've already long made, and I stand by them actually.
So you've lost patients or lost patients because they were unwilling to wear masks?
One of them I actually fired, and I think I texted or communicated that with you just recently on my travels in the airport. You know, the patients there choosing to not wear a mask over his nose, and you know, there's half a dozen octogenarians on this little Montrose plane. A friend of mine who happens to be on her way to get chemo for her metastatic brain cancer in Cleveland, that's on the plane. And, you know, I think if you're asked politely to wear it correctly, I don't think that's asking a lot. And then sort of speaking directly with that person in the airport, um, I'm not interested in you telling me about the physicians who don't believe in masks. You know, for every one physician that says that, there's probably, you know, 10,000 physicians who say the opposite, right? So, so yeah, so so therefore, you know, I have a patient who's died. I have two widows in my practice, and it breaks my heart to think that those people out in the community are seeing people that can't even bother putting a mask on, and they've lost a loved one, they lost a husband over this, and I just find that unkind and a lack of human decency. So I don't need those people in my practice. I just don't. So, and the beauty of it is I don't have to have them in my practice. They can find another doctor who better fits their views, I suppose. So, yeah, how I would handle that if I didn't have my own private practice, that might be challenging, but since I don't, I can make those decisions.
That's awesome.
Well, it is, and I mean, it is and it isn't. It's really unfortunate that it has to come down to that because of the mixed messages that people have heard. And, you know, when you have Dr. Fauci out there making recommendations and then having some other physician and the or ophthalmologist or radiologist who's hired as an advisor giving information on public health, like they have no business giving information on public health if they're a radiologist and an ophthalmologist.
Mhm.
So you know, we have well-trained individuals who should be handling this, and they're not. So yes, I'm sure it's confusing. Um, but you know, I think as your physician, there should be mutual respect and trust, and I don't think there can be a good patient-physician relationship if those things aren't in place.
Yeah.
So also interesting, I've had a patient, or he and his wife, who have been very involved in their church community. Like he, I think, did their financials for a number of years. They've been leaders in their church community. They participate in Bible study. And, you know, here it comes to the pandemic, and they really struggled because their church was sort of ignoring all these guidelines, and a lot of elderly folks in their church. So they became very frustrated and somewhat disenfranchised with that church because of that. You know, they almost became the outcasts, and you know, there was probably another half a dozen or so church members who were in the same boat as them, who were, you know, being smart about wanting to have social isolation. They wanted to go to church, but you know, have everyone wear a mask. How hard is that? And do you
Mhm.
really need to be singing? Of course not. You don't. Like, um, so they, you know, they have struggled along with that. It was somewhat like when it was a different church that had that outbreak, but they obviously felt validated at that point with the outbreak that had occurred in the other church.
Yeah.
It also somehow, which I still can't even get my head around, it also somehow, from a religious point of view, I it has also become like this badge to not wear a mask. And I think if you look at every religion on the planet, it is, you know, love thy neighbor kind of message that most religions promote. So if you really loved your neighbor, wouldn't you wear a mask? Like, it makes no sense to me that you proudly go to church and proudly don't wear a mask. Like, I really don't, those neurons don't connect for me. It is almost like we have that religion has taken on a non-existential or non-spiritual, you know, now it's just this worldly grounded earthly view of defiance as opposed to the greater good, if you will. So I find that as an interesting religious switch. At one point, I actually contemplated making up a sign and posting it and just say, like, what would Jesus do? And put a picture of Jesus with a mask on.
Yeah.
See how that would go over, you know. It is one of those things, you know, as religious organizations. So I honestly, I can't explain at all. And you know, as I've mentioned, just helping patients deal with that and validate them in that context, I think that's been interesting.
Yeah. It's it's sad. I find like I feel validation, you know, when Trump got the coronavirus. I thought, well, finally, now he's gonna nope. Nope, he's not gonna learn, and I feel bad for being glad that he experienced that. You know. Um,
But the downhill effect of that, however, would have been massive. Had, you know, if he was Chris Christie, for instance, you know, Chris Christie, who, you know, was in the ICU for 6 days, publicly came out and said, I have made a mistake. I should have been wearing a mask. I apologize for that. I underestimated the virus. But immediately when Chris Christie came out and said that, you haven't heard from him since, from the GOP.
Yeah.
So, Donald Trump got treated in a way that you or I would not have gotten treated in terms of likely the pooled antibodies that he received. So you also, or we weren't privy to, for all we know, they could have had a hospital bed set up in the White House, So, oh yeah, he left the hospital, but really they had a hospital bed set up in the White House. We have no idea that that didn't occur or any of those things. But the thing is the care that he received is not the care the average American is going to get.
Yeah. We don't have a chopper
So yeah,
waiting to take it.
we all had wishful thinking. We all had wishful thinking of that, so don't feel too guilty about that. Um,
Where are you getting your professional information?
So Montrose has done a really great job in terms of trying to keep everyone informed. So Dr. Dragna, who's a family practice physician, is the medical director for Health and Human Services here. And already in place in Montrose is we have Wednesday morning conferences for providers that we would normally present interesting cases, kind of a multidisciplinary look every Wednesday. So that easily transformed itself into a Wednesday AM briefing. So every Wednesday morning, we have Dr. Dragna give a presentation on the local numbers, what's happened over the past week or two, how many hospitalizations that we've had, how many people are in the ICU, what the trends have been, the people who have been positive, what age groups are they in. Additionally, then he goes through what's going on in the surrounding counties, essentially what goes on in the state, and then how we compare to the country, essentially in that way. And then kind of our local internal medicine specialist docs who have taken a big interest in this, specifically Dr. Bolton, Dr. Brzezinski, Dr. Loki, they have been pretty on top of care recommendations, so cutting edge care recommendations. So then we potentially get an update from them as well. So, once that is complete, then we may present cases after that as we would normally do. So that has just been a great segue and opportunity for us to stay informed locally. And then Julie Disher, who's our physician coordinator, basically sends out a summary of that to providers as well who might not have been at that meeting. So I think they're actually recording it now so you could listen to it. So that has been really well done, I think, on our medical staff's part.
Can we switch gears a little bit and talk about health insurance?
Sure.
One of the additional follow-up questions was how is access to health insurance affecting patient and community members' responses and beliefs about the pandemic? Have you seen a decline in
access to health insurance?
Have people been losing their health insurance in Montrose?
So I don't know that I've noticed that decline at this moment. I mean, obviously, I think a lot is going to hinge on the election, whether or not the Affordable Care Act is coming to an end or not. I am a bit confused. I just heard yesterday, I had a patient who one of the programs that she was offered was the Rocky Mountain program here, that they have 3 options. But my understanding is Rocky Mountain is now United Health. I don't know why they just don't rename it United Healthcare, because that's who owns Rocky now. And my understanding is our local community and hospital wasn't able to come to an agreement with Rocky as far as part of that contract. So I was a bit confused at how they're marketing this plan, that I wasn't clear that we actually had a contract with them. In our health, to think that we could not come to a reasonable agreement with Rocky, i.e. United. United made $14 billion in 2019. So that in and of itself says volumes about our insurance industry. I think they have been essentially able to create a monopoly for themselves And, when you look at all these rising premium rates, it's under the guise of all this, extra costs that they've had. But if we were to roll back the clock to the first 6 months of 2006, our hospital census was really low because people were essentially afraid to go to the hospital. Hospitals weren't doing elective surgeries, right? So if you think about how much money insurance companies saved because they didn't have to pay for elective surgeries or colonoscopies or mammographies, they didn't have to pay for any of those things.
Mm-hmm.
So for them to continue to increase rates, it's purely for their own profit. It is not that they're covering extra costs.
Yeah.
So it's they're well disguised thieves, is what they are. So yeah, and the amount of influence they have on Congress on both sides of the fence, it's very unfortunate because it's the public that suffers over that.
Yeah.
Is what happens.
I think people concerned that they're going to lose their private health insurance. The private health insurance is extremely expensive.
Yeah, clearly, and yes, the folks who have lost their job, if they had health insurance with that, then yes, that will be obviously a decline in that private insurance. But it is reaching a point where it's becoming unaffordable for businesses to even give people health insurance at this point in time because of how absurdly expensive it is. And also, if you think about like Medicare, I find it interesting that I hear people complaining about socialism, but they're on Medicare. Like Medicare is a socialist program.
Mm-hmm.
So, and believe me, people are joyful when they get Medicare. They're not complaining about socialism when they get on Medicare, clearly.
Yeah.
So, right. So I do think it's, there's just such disconnect over that I think the only way our country will maybe get ourselves there is if you just say, okay, now you can get Medicare and you're 60. Now you can get Medicare and you're 55. Now you can get Medicare and you're whatever, and just keep lowering it to allow people to buy into that plan in some way, shape, or form. That's how I see it, because even though I very strongly believe in sort of single party payer, a minimum insurance for every American, I just don't see our country getting their head around that, actually.
Yeah.
So I think it's going to have to be some gradual way that'll happen. It's it's challenging now. Obviously, the election results are still pending, right? And ideally, we count all the votes. Imagine that in a democracy.
What? Yeah.
So,
I would maybe one day my vote will count as much as somebody's vote in Pennsylvania. We'll see what happens.
right. That's exactly right.
I didn't hear, did Colorado pass
Wisconsin, California.
Did we what was the to do away with our electoral college? Did you hear if that passed?
I haven't looked at all. I hadn't looked at the final tally on that. Last night when I looked at it, they were still sort of tabulating all that. So I have not looked at that to see what we did actually between the wolf and late term abortions. When I looked at that last, it looked like that it was going to be voted to do away with that, which also, it's just so horribly misinformed that would go away. Actually, I had one person in my career, actually, I take that back. I've had two in my career that have had late term abortions, and they have been horrifically painful for the couples having to make that decision. It is insulting to me as a female that people imply that pregnant women at 7 months just go, I don't feel like being pregnant anymore. I think I'll go get an abortion. Like as if that's what women do. That's outright insulting, because that is absolutely not the case. in late-term abortions. It is one of the hardest decisions that couples have to make. And to think that we put that to a vote,
Yeah.
like that is nobody's business but that couple's. So that is, and to see the ads that go out with that, they're insulting ads to that go go along with that, right? So if that in fact passed, and they're going to limit that, that will be
I
very
don't think it
unfortunate.
did, and I'm praying that it
Oh,
doesn't.
okay.
I don't think so.
Okay.
We were talking about here
Because
in the office,
when I
and
looked last night, it looked like it was gone.
oh, I heard the opposite,
Oh,
but I
I
don't
didn't.
know for
Okay.
sure. I'll have to check. Have you seen any burnout in your professionals that you work with, or when you have those Wednesday meetings? How is the healthcare community holding up there in Montrose?
I think I think our radiologists have been appear to be burnout, because normally they were pretty reliable in attending these conferences, and they haven't been. So perhaps within them, that appears to be the case. I have not spoken with them personally. As far as the other primary care providers, not to my knowledge, but the reality is I'm in my own private practice. So it's not like we have gatherings, meetings, et cetera, where we would meet and even talk about those things. So I don't know that I could honestly speak accurately to that. I can only comment about how I'm doing. I'm not aware of anybody who's struggling, but I might not be if they were.
And how are you doing? Are you ready for this winter?
Am I ready for this winter? Well, whether I'm ready or not, it's going to come.
Yeah.
So it doesn't really matter whether I'm ready. I I'm really pretty okay with fielding what I need to field as things come, and I don't struggle with change. So I think whatever we need to do, we will do and get done and get everybody taken care of in one way, shape, or form. So I'm really okay with that. I can tell you, emotionally for me, I can, like, I went in early to get retrained on the hospital computer system, because I haven't done inpatient medicine in probably 5 years. What they asked, like, if our hospital's overwhelmed, would I be willing to go in and help out? So since I'm like, I had to go get retrained on our hospital computer system. So really, I think to myself, how challenging that's going to be for me if I feel like I'm risking my health taking care of people who couldn't bother wearing a mask, right? Healthcare workers are 3 times more likely to die from coronavirus, and the average age of death for healthcare workers is 57, compared to about 74 for the average population. So I look at that also as kind of a personal insult when people don't wear a mask. Like, somehow it's okay that you're putting me at risk as a healthcare worker, and you're going to then expect people to risk their lives to take care of you, and you couldn't even bother wearing a mask. So that's going to up the ante for me, really, if it comes down to that, of being in the hospital in that kind of environment. So we'll see if that comes to bear. And I clearly, it would be my fantasy wishes, but imagine now on our driver's license, you can decide whether you want to donate your organs or not. Why not have a box on your driver's license to check a box to say, yeah, you're not a mask wearer, so that if you get ill, you don't get a ventilator, and we're not going to spend resources on you. Like, be that courageous American that you think you are,
Mm-hmm.
right? Check that box.
Or leave
But
it in
will that
God's
happen?
hands.
Yeah, right. Exactly. So that's just that as I said, like the fantasy that would happen, but that would never happen. People get taken care of. Um, and I think without consequences, people get to do what they get to do because they still get care and quality care despite that very conscious decision,
Yeah.
So yeah.
I've been so frustrated hearing people talk about my rights, my rights, my rights, my rights, and not anyone ever thinking my obligation, my duty, my responsibility, my commitment, I guess. I know it's exhausting, God, wearing a mask every day, but we can do this. We can.
Okay, and that same person had, a brain tumor. Do they think their neurosurgeon's going to be so exhausted doing a 10-hour surgery wearing a mask? It's just ludicrous, is how I look at that. And, you want to feel what it is to feel short of breath. Wait till you're getting intubated, right? How that's going to feel for you. So, and the personal rights, we already have those. In effect, you can't smoke in public places. Why can't you smoke in public places? Because it harms other people. Why can't you drink and drive? Because it's risk to other people. Yeah, you have to wear a seatbelt. We already have those in place. It's called what your responsibilities are living in a society and within a community. There are obligations that go along with that. So the whole personal rights thing, you don't have a right to put others at risk, actually. And we've already established that in this country. So that's nothing new. But it is fatiguing to listen to that. So.
Well, there's just so much misinformation out there. I was walking in, get my to-go order the other day with my mask on in the parking lot. And so, out of nowhere, some man pops in, 10 years ago, Fauci did a study that, breathing in your own bacteria in your mask is going to make you sicker than the virus would. Where people hear this stuff and how they get their information and how, social media impacts that, or word of mouth, or politics, where people get their information. I don't know.
Well, it's that, and I think from how do you change medical education? Well, you should train people to be critical thinkers. I mean, I feel like throughout my career, what has served me best has been to be a critical thinker. And unfortunately, in the beginning, when you're just trying to learn so much, you almost don't have the ability to be that critical thinker. You just have to get the information that you're getting from your mentors, from your teachers, and believe that what they're teaching you is accurate. Unfortunately, though, there needs to be a point when you become more of a critical thinker, because so much, well, I shouldn't say so much, but there are often things in medicine that are dogma that have just percolated down the pipe along the way. Nobody's done really a study, or nobody's gone back to look whether it even came out of the gate with a valid study. So there are many things in medicine that wind up that being the case. And to give you the most simple example is, back in the beginning of my career and training, what was I told at that point? That, if women had a bladder infection, you would counsel them on how better to clean themselves, how better to wipe, whether you're wiping front to back or back to front, because clearly it's a result of you being dirty and dumb, not knowing how to clean your own genitals as a female, right? That was what I learned. However, then finally, guess what? Someone actually did a study and showed that that wasn't true at all. That wasn't the case. And it had nothing to do with women getting bladder infections. So, there are many examples like that in medicine, but that's just one of them that I think is just the most obvious. So I think as part of the training, it probably would be useful to share some examples like that, so at least those students have somewhat of a fighting chance when they down the road to be able to pause and think about some of the concepts they may have learned.
Mm-hmm.
So, and medicine should be changing. Like if I'm absolutely not practicing the same medicine I did 20 years ago or 15 years ago, 10 years ago, et cetera. And, that medicine is dynamic in that sense. And the other piece of this is just interpreting medical literature and how horribly biased that is. So that really should be part of medical education. I'm not sure it's just a pandemic thing per se, but I really feel like that should be important in medicine because the pharmaceutical industry influence on published data is so strong, I think, and it's just underestimated. The top medical journal, the New England Journal of Medicine, basically, their first female editor, she was in that position 7 years and then bailed out because of how corrupt it was, and basically wrote a book about it and whatnot. So, when you think about that, if the New England Journal of Medicine is that, then you can be very clear that the rest of the journals are as well.
Mm-hmm.
And then even to pause and think, why does it cost something for me to look up literature? Like, fortunately, I have a subscription to the hospital, but a lot of these studies are funded by public grants and then get published in places where then I don't even have access to them, despite the fact that they were done with public dollars. So that in and of itself is also wrong. And those those are things that should be part of medical education, because those skills are then helpful to have when you're in this pandemic and be able to know how to critically look at the information you're getting.
Do you have a story or two that would sum up some of your experience so far?
Mm, a story or two. Well, um, I think kind of the ones I shared already, I think are probably, I mean, fortunately, those are not what the majority of my day is. Those are thankfully, the outliers. Um, the majority of my patients have been pretty conscientious and thankful that I have taken the precautions I've taken within my office itself. So, um, when you see people who are, at least here in Montrose, who are breaking the rules, if you will, not social distancing, not wearing masks, what the bias is you're not seeing the people who are appropriately staying home and self-isolating. Like you don't visually see those people. So sometimes I have to remind myself of that because it can be terribly disheartening to see what I would hope to be the minority. I'm not so clear it is the minority here and clearly not the minority in Junction, but I think the folks that are doing what they're supposed to be doing, at least in the context of my practice, is the majority of patients. And and I think that's an important thing so that you don't get burned out in that way, to realize there are a lot of people who are trying to do the right thing as best they can. So, and I have, many patients who express that or are thankful for that, and that's what keeps me going, if you will, is to continually be reminded of that. So I think that's probably worth highlighting more than the outliers who are choosing to not do the right thing.
Um,
Yeah, because the other thing I've had to do is I need to be better about just going to the grocery store, a half an hour before they close, because that's when I normally used to go when I had kids in my house, just because that's when I had a chance to go.
Mhm.
Now, uh, I yeah, I just to to have to go to the grocery store or another place and have people behaving as they're behaving, it just makes me feel sad about our human species as a whole. And maybe we are the virus in that context. so um, so yeah, so I probably, for my own emotional and mental health, need to start going to the grocery store like at the very end of the night with minimal people
Mhm.
there. Or I think natural grocers. I think the percentage of people at natural grocers wearing masks, I think, are higher
Probably.
than city market takeaway. Yeah, but then the other thing, like was just you go back to New York and everybody has a mask on. It's not like it's a decision. And people have a mask on, and the other thing that I have chosen to do here is if you're a business and you're not going to wear a mask, then I'm going to go spend my money somewhere else. So, that's going to be a financial impact on that business. And, I love to support local business, but not if you're not wearing a mask. And if I
Mhm.
ask you to put a mask on and then you're choosing not to, my answer is you're in a customer service industry. This is about customer service. Whatever you believe, it doesn't matter. If you see me come in your store with a mask on, I think that would behoove you to put a mask on. And,
Mhm.
your choice not to, my choice is to not spend my money here.
Yeah.
So, you know, so that I've had a couple of local businesses where that's going to be the fact of the matter moving forward. So I will not spend my money there. So, um, so yeah, it'll be interesting to see what comes of this pandemic. One of the things I have in my office is it was out of the Week magazine. They did a history of pandemics, basically. It's like a one-page summary of the historical perspective on pandemics and what has come out of each of those pandemics. So I think the earliest pandemic was about 4,000 years ago during the Peloponnesian time. So it basically goes through in little blurbs what was productive that came out of that,
Hmm.
and like what was productive that came out of the Spanish flu. So that sits in my waiting room to ideally, as to give people some hope about that, ideally there will be a silver lining in this and something productive will come forth from it. It remains to be seen, though, at this moment.
Yeah.
So the beauty of having my own office is I can put whatever propaganda up I want.
Nice.
Right.
You got to
So,
get them at every
no.
opportunity. You got to get your message
Hmm.
out there.
Oh, oh
Uh,
yeah, yeah. And in fairness, my patients know what they're getting, so it's all right.
That's good.
And if it's not okay with it, they can go someone else, and they can go somewhere else. Like, I have patients come and go from my practice, and my thought is if you feel like there's greener grass elsewhere for you, then you absolutely should go take advantage of that. You know, so I am okay with that.
Well,
So
thank you.
works for me. Yes, it was good to catch up again. Are you doing okay? I should ask you how you're doing.
Oh, yeah, I'm doing okay. We had a couple scares at my daughter's school, but she's fine,
Uh-huh.
and they went back today at East Middle School. It was a really hard decision to put her in-person learning. Um,
Hmm.
I'm glad that I did because I think she has an appreciation for it that she has never had before. Um,
Hmm.
that she really wants to be there, and she has like come into her own as a 14-year-old.
Hmm. Hmm.
but every day it's a
Yeah,
little.
and that is, yeah, that's a really big lesson though for her to learn, because I feel like, having done volunteer work outside of the US in very underprivileged areas, school here is, you just get to go to school. And in other countries, um, yeah, if you don't have enough money, you don't get to go to school. Or if your parents need you to work in the field, you don't get to go to school. So for many American kids, they don't ever realize the opportunity afforded them, actually. So I think if that alone was what your daughter got from this whole thing, well, that's a giant gift, to be thankful for the opportunity to be in a learning environment like that. So there's your silver lining.
Yeah, she just has to keep remembering that, and she will. She's doing good.
Yeah,
But I'll
yeah.
be
Well,
glad when
good.
it's springtime. I have this like dread and the stress. I felt it last spring. I was thinking, well, what happens in the fall? We're still going to be in the middle of this come December. So I'll be
Right.
glad when springtime comes.
Yep. Yep. Yeah. Right. Well, one step at a time. We'll get there.
Alrighty.
So,
Well, thanks again.
all right. Well, good luck with everything.